Hey everyone, welcome back to your Weekly TheraTea Podcast. My name is Tal Williams, or Mr. Williams. I'm a teacher, a therapist, and a social worker. And over here we have the lovely...
I'm Anne-Marie DePietro, and I'm still a nurse practitioner.
And you had your bachelorette party this weekend.
I did.
Did you have fun?
I did. Did you have fun?
I did. I thought it was a blast.
Yeah,
Tell them where we went.
We went to Marco Island in Florida.
Yeah. It was fun. It was really warm.
Oh, it was really warm.
Yeah.
We were baking.
Well, okay, so, because obviously, bachelorette party, we based off of, what the bride wants to do.
Uh-huh.
And Saturday, we went to the beach. Uh-huh. And we went to the beach, all day.
You don't usually do that?
Not when it's, because it was, 9:30 to... What time did we leave? 4?
Oh, yeah, that's my jam. That's what I do.
I think, normally, yes, but, this was, not a private beach, but not a public beach. Mm-hmm. And usually, the beaches I go to, because you have to remember, I'm from the Midwest, so we have, Lake Michigan, and there's always, a restaurant or something you can, walk over to or close by.
You don't have to cross a lagoon.
Oh, my gosh. The creature of the lagoon was us.
Yeah. There's, a lagoon. This was, what was the beach called? I'll think of it. But anyway, in Marco Island, we had to get to the beach by crossing this lagoon. Otherwise, you had to, walk. I don't think you could even walk. Mm-mm. I think you have to, drive, down by, where the high-rises are and whatever.
Yeah.
Your only other option is to go across the lagoon. But the lagoon also has tides.
It sure does.
So we didn't think of the lagoon having tides.
Because I thought it was a lake almost. Because a lake would...
Right, that's what I thought too. Just water collected 100%. In a body, right?
Yep.
So we trek across and we're all joking it's the Oregon Trail. And, we're going and got our little butts wet a little bit. And, we're oh, we made it. It's great.
Yeah.
Then my friend Kristen left before everyone else, and she
went during high tide.
She texted and was the water is above my waist to my nipples.
It was, when we were crossing, it probably never went over our knees. Maybe a little bit, if there was little divots.
Yeah.
But the way back, fully up right under my chest.
And the water came so much further, down that pathway.
Yeah, there was a little path that had trees or something on both sides, or just and we were walking, and I was ooh, this is a little claustrophobic. And on the way back, it was I don't know, probably 6 inches of water, definitely mid shin. Both sides are this. We're carrying umbrellas and chairs and blow-up flamingos. Yeah. And after being in the sun, so we're all kind of no one burned. Well, we'll talk about this later, but no one burned. No one got sunburned, but we were I don't know, being in the sun, you get red, and then being in salt water and sand, you're just
yeah,
steamy.
You have that sticky, dry, body feeling.
100%. You just want to douse yourself in lotion. Because we had SPF 100.
Yeah. Yeah.
But it was going through there. I was oh, and then we get to the lagoon again, and it's to the chin.
Oh my gosh. Even my friend Kelly is tall.
Yeah.
Over 6 foot.
Her
legs are
or something.
8 feet long.
Yeah.
And it was hitting
she
her
dipped
stomach.
In. She dipped in.
Yeah.
I have to ask this because I was you ate oysters.
Yeah, I love oysters.
Yeah. We went to one restaurant and you were she was looking at the oyster menu. And would you say to him, I'll just have one of every flavor?
Yeah.
What is it? Yeah.
I was I would like one of every type of oyster you have. And they had 18 different types of oysters.
Yeah. And you always have these long, extravagant, cute nails. Actually, those nails.
Yeah.
And then she was unshelling them. What's it called? Shucking?
Well, no, because they're already shucked, but
right.
when you have an oyster, sometimes it's still attached to the shell,
Yeah.
and that's like it's still alive. Or sometimes they like detach it for you. But like if you go to like scoop an oyster into your mouth and it's still attached, it's going to be like so awkward because you're going to be like pouring cocktail sauce or like whatever into your face because it's not like leaving the shell.
Right.
So I take my little nail and I. This was like not an okay motion.
I was shooketh. I was like, oh my gosh. I guess like we have the pour house with the P, a pour house, P-O-U-R. Because the first time I heard someone say pour house, I thought they said whorehouse.
Oh my god.
Horror house. And they have like, was it oyster buck chuck thingies? You know what I'm talking about?
Oh, shuck an oyster.
Yeah, and it's like $2.
Oysters.
But like you can go in and have like a $2 oyster or something like that. You get like a bucket of them and you just like eat them. But I went once with like a group of teachers and I'm like, I can't. So when I was like watching, I was like, it looks like it'd be so good. I can't bring myself to eat it.
Why?
I don't know. I think it's a texture thing. I'm nervous.
Oh my gosh.
Like what happens
so
if it's bad?
And I mean, some of them aren't great, but that's why it's cool to try like all different ones because they all taste different.
Yeah. It was also like just fun to see so many people in like their self-care mode because like everyone works. We had a colorist and hairstylist. We had a teacher. We had us who do both. I mean, I feel like everything under the sun of mental health and education. What does Molly do?
She works for actually a mental health company, but she does their like advancement, so like donor relations stuff.
So fancy stuff.
Yeah. She's kind of a big deal.
Yeah. It was fun to see everyone like relax, but like you have a very, so we were saying show and tell. You have a very unique thing that you like to do. I guess it's unique. But what is that?
Shelling. So we called it the Bachelorette because I wanted to go to Marco Island because I saw on TikTok these like giant conch shells. I think they're called horse conch. I don't know what they're called. But anyway, so Molly and I went on Wednesday. And so Molly and I did like a 7-hour long shelling tour on Thursday. And then the next day, the day everyone was coming, so Kristen came Thursday night. So then Friday morning, before all you guys came, we did another shelling tour. So the boat takes you to like different islands, like unpopulated islands that just have like shells on them. So one story before I show my show and tell though, because I thought of this in the shower this morning and I was like, I hope he asks me something that I can tell this story. So you mentioned Kristen was a teacher, right?
Yeah.
So you know how Tell is. If you don't know how Tell is, it's like he's going to be recognized by every teacher under the sun. Like, God forbid that happens.
Wait,
so
do I know the story?
No.
Oh, okay.
I haven't told you this yet. So, you know, Tell's like, oh my God, teachers, they're going to know me. So Kristen, Molly and I were on the shelling tour and Molly was just asking about like who else was coming and whatever. And she was like, I wonder if the shells are going to recognize Tell.
They did, and they sure did though. They didn't, I promise.
Yeah. Will even the shells recognize Tell?
No, we actually got scot-free.
I know. No one recognized.
No.
He's not even that famous anymore.
I don't think that Marco Island is my demographic of people.
No. And Kristen was not even all about your business.
I think most people who meet me after, like, in a actual social situation,
don't like you.
They just like, I think the least interesting part of me is social media, by far. Like, I don't think that it's like, if someone comes up to me, they're like, oh my God, I know you from TikTok. And then they start talking to me like, oh, it's actually not that interesting about you. Like,
I thought it was nice how, like, we kind of just, like, all fell into, like, a platonic commune.
Yeah, 100%.
Like, we could have just kept living like that.
It just, yeah, I feel like everyone was very, like, there was no, like, if someone needed something, they would say the need. There was no like awkward hesitation. It was like nice to just like chill, and there was no like
the Spice Girls. Like we
really
all had our roles.
We really did.
Thank God we had Molly and Kelly. They're moms.
The moms of the group for sure.
They made sure Tell and I didn't get sun poisoning. They were literally going around spraying us with sunscreen. You do realize that, right?
Oh yeah, because at one point Kelly goes, she's like, actually you don't look like you got that red, and then she took off her sunglasses and goes, how do you feel about sunburns? I'm like, I think the last time I got a sunburn was like I don't know, years ago. And she was like, your shoulders are so red. And I was like, oh God. So she sprayed them. And then I think Molly sprayed them again at another point. And then the next day she was like, oh, you weren't kidding. They're brown now. I'm like, yeah, usually it's not. This, though, that was sucked. But
that was all for the TikTok.
That was all for the TikTok, babes. I want to hear, I want the shell.
Oh, the
shell.
Okay. So this is a lightning whelk. That's what it's pretty big, right? Like,
yeah.
This is big. So I don't even know if you know this. So the first day when Molly and I were on the 7-hour tour,
oh my God.
I was obsessed with getting a giant shell.
Yeah.
I mean, the horse conches are actually bigger than this. They can be like 12 to 24 inches.
Oh my God.
So like when we do a reunion, because Molly said we're going to do like Bachelorette Part 2. Like every year, we're just going to have my Bachelorette. Yeah.
Same weekend.
Yeah, just the 5 of us,
yeah.
though.
Yeah.
No one else. So eventually I'll get my horse conch. But anyway, so I was like saying to the captain of the boat, because it's just me and Molly on the boat, because of course I had to charter our own boat so that I could go to the 100%. Islands I needed. So he takes us to this island that has a lot of trees, because he was like, the big shells get caught in the trees, like as the water comes up.
Oh, that makes sense. Okay.
So picture Molly and I climbing through trees.
No.
We're full blown climbing through trees in the forest. Like my wound from the glue gun opened up. We're like underneath branches. And then all of a sudden Molly's like, Emery. And I was like, what? She's like, I'm not kidding. I see one. And then I like ran up as much as you can run, jumping over branches and stuff. And she's like pointing, and it's like literally in the middle of like some like, I don't know, rat's nest looking bunch of wood. Like, how do I get to it? But I got to it.
You found it.
Here it was.
You got there.
Yeah. Because the thing is, a lot of them are, when you find them, they're like at the beach, like alive. This one was dead.
I don't get how shells can be alive.
There's something in it that's alive.
But how's a shell made?
That's something that I don't understand. Do you know that shells eat shells?
Shells eat shells?
Eat shells.
I'm so confused because I also was in LA the weekend before, and there's something called, what's it called? Ocean glass or sea glass.
Oh yeah, you didn't know that?
No, I was like, someone broke a beer bottle. They're like, that's sea glass. I'm like, what the hell, sea glass? I'm so confused. The ocean is a different world, and aliens live in there.
Have you heard of like sand dollars?
Yeah, I know sand dollars because they look like little stars.
Yeah.
Yeah, but
we found some of those. I have these 2 other shells too. These are like boring ones, but I haven't unpacked all the other ones yet.
There was a trash can filled with shells. Like, and I'm not talking like a trash bin. I'm talking about a trash can filled with shells. I was like, oh my God.
Molly's suitcase was 8 pounds overweight.
What did they do?
She had to take the weight out and carry it on. No. Luckily, I can have 70 pounds because mine were almost 70 pounds.
Oh, that's just too much.
Yeah. I'm not sure what I'm going to do with them yet, but this one, it's already made its way to the office.
We also thought it'd be hilarious to prank Kelly, your colorist, who's like doing her hair and everything, obviously for the wedding.
But she's very emotionally invested in my hair.
Yeah, like very much so. And so we thought it'd be funny if
like she brushed my hair in the mornings,
right, and would like style it. It was like super cute. Yeah. So we thought it'd be funny if I got some box bleach. I ended up spending like, I don't even know how much money on box bleach, but we got box bleach, and then I was like, I'm gonna put bleach in my hair, and then I'll walk out and say like, is 40 volume too much? And and so we did that. I said we took tinfoil, put Anne-Marie's hair in it, and I crunched it up, right?
He crunched it up hard.
It was it like not rolled, not like neatly, just
like
crunched.
It was knotted in my hair.
Yeah. And then I put the bleach in, and we waited for it to like start turning. And I said, hey, Kelly, is 40 volume too much for bleach? She's like, yes. I said, like, just for this like little box though? And she's like, oh my gosh, what are you doing? She's like giggling. I'm like, I just like want to know if it was too much, because like we put on Anne-Marie's hair too. And she was like, no, you didn't. And I was like, no, we did, because so she goes in because my hair's turning.
Well, also
blonde.
you have to know she's across the house.
Oh, she's like not by us. We are in the bedroom, the
like, this
bathroom.
House was huge.
It was huge.
He's
and
calling to her from her room, which was on the other side of the house.
The only reason why I think she could hear is because there's no carpet in this whole place. And so she's like, oh my gosh, we'll post the video. What are you doing? And she like...
She was shaking, trying to undo the foil.
And then she gets it. You guys are joking. You're joking. I said, no.
Please be joking. Please be joking. Please be joking.
And Amber's like, I just wanted a little red streak for Colleen's team. And then I showed her these red crystallite packets to make her think that's what we're going to put in her hair. You know, like when you used to dye your hair with Kool-Aid. When she unraveled that, she was so relieved. Thank God she had laughed. She was like almost like on the verge of like tears because it would have.
She did cry.
Yeah.
I mean, Kelly does cry at the drop of a hat. Love Kelly. Yeah. But I knew she would cry. That's why I was like, we have to invest in this. Right. Like, commit until she cries. And
she thought, thank God she laughed and thought it was like hilarious after that. But then she was like, you need to let me help you with your hair. So, and the poor thing was like working with like box bleach at that point. And so we got to a point where it was like light enough that she's like, when you get home, do this, this, and this, and this. So I was able to tone it. It was heat miser.
Maybe just go to Kelly next time.
Oh, for sure. So all that's to be said, if you're watching, there's a red streak at the top of my head. It's not a sunburn. And I don't know if it's because I was, after being in the sun all day and then putting bleach on your hair, it left this adorable little red mark moment. Feels good. It doesn't hurt. That's good.
That's good. What was your favorite moment of the Bachelorette?
I don't know. I just like being with everyone. I think it was such an easy group to talk to, and like everyone was able to jump in and joke and like have conversation.
Yeah, we were laughing, man.
Yeah. What was your favorite?
I was just like astonished at like I feel like within 5 minutes of everyone getting there, we were all just like talking like we had been friends forever. I was low-key nervous about like the teacher dynamic thing, but it was like it didn't even exist.
I feel like I said this to a client the other day because he was having his bachelor party, and he was like, I think everyone's nervous bringing a bunch of different people together and that's in their worlds. And I'm like, the common thread is you. And if they get along with you, they're going to get along with other people. I'm saying this, people are probably like, not in my case.
Yeah, I was going to say.
Most of the time with the wedding stuff or things I've been involved with, it's been pretty like fun and easygoing. You know what I mean?
I just thought we were special.
I mean, I think that like the dynamic was good. And I think that like, obviously people are special because we were there. It was us.
Duh.
Abby. Are you ready? Bum, bum, bum. We got questions.
This is it.
We
should have had some exit music.
We just did it. Me.
This is it.
This is it. Cake by the ocean. You know.
I don't know. I didn't even know what cake by the ocean floor
I had to explain that cake means butt.
Yeah.
I didn't know.
Tell taught us so many words.
So many. I'm like, okay, let me help you out with this. Like the bagussi for bagels.
Oh, I could never remember bagussi.
Yeah.
What was I calling it? Bagussi?
Yeah, everyone was. I'm like, it's a bagussi because it's the bagel. It's a bagel. I taught them so much.
You did.
We did this last week. We thought it'd be fun to do it again because we had a lot of questions that were unanswered and then new questions came in. So we printed out some random ones here and we're going to take some time to read through them. Since it was your bachelorette party, do you want to grab the first one? Or do you want me to?
Are we doing top of the pile?
Yeah.
Okay. Any tips on how to deal with college roommates who all of a sudden have been rude to you and are not saying what you did wrong?
This is hard. If you truly didn't do anything wrong, in my opinion, right? Your friends might be shitty friends and you shouldn't be friends with them. But I don't know, I think that's difficult. Like, are they just your roommates or are they your friends too? Because there's a difference.
That's true.
You know what I mean? Like,
yeah. So college roommates who all of a sudden have been rude to you. Yeah, that is different.
Yeah. If it's your roommates and it's like awkward and like you don't want to live with them, like talk to an RA. I'm very much like, you don't have to be friends with your roommate. Were you friends with all your roommates?
No.
Okay. Well,
remember the ferret story?
Never mind. There was, yeah. Yeah, I think like when my freshman year, I was randomly put with someone. We couldn't be any more different, but he was very parenting of me. He was like this big football player, and he's like, "Where are you at? Where are you going? Are you coming home? Are you okay?" Like it was just too much for me.
Yeah.
And I was like, I don't need a parent here. Like
Yeah.
I specifically went to college so I didn't have to be around my parents. Love them.
Yeah.
So I feel like in that case, like had he not gone home, he went home most weekends, then ended up moving out in like March because his dad moved into the city that our school was in. I probably would have been like, I need a different roommate. I'm feeling like very, what's it called? Like
Claustrophobic. Smothered.
smothered. Thank you.
Yeah.
Um, yeah, and like you had a roommate with a ferret at one point. Like that's
Yeah, so we lived in my sorority senior house, but like somehow we were like down a person, so we had like random people moving in. And so this one person moved in who was like never there. The door was always locked, but there were ferrets in there. So like when they were gone for an extended period of time, me and Kristen and we had another roommate, Kim, and I don't know if Molly was there. I think Molly was there at the time. We like broke into the room to check on the ferrets,
because
and
they
then
weren't
we
taking
also
care of
found
them.
dirty tampons.
No.
Yeah.
I would
it's
immediately be
true.
like, this is serial killer energy.
Yeah. No. I mean, we called it the 419 because the address was 419 West Beaver, but
I'm so sorry.
what?
The street was Beaver Street at
Yes.
that. That's too much for me.
Yeah, Boots was on Beaver Street too with the Boots children.
Oh my God.
Yeah.
I'm like dying.
Tell learned so much.
I
about
just,
Penn State.
listen. But I don't know. I think, yeah. I mean, what's your opinion on it? Like,
So I'm always a big believer in like people should just like put shit out there.
Yeah.
So like one of my clients was talking to me about an issue with a college person that they had that was in like an extracurricular activity with them who was like also smothering but also being a bitch to everyone else in the group. So it was sort of making my client like guilty by association,
Yeah.
even though she wasn't
Yeah.
choosing to be. They weren't choosing to be. And so I was like, you just need to talk to them and be like, listen,
yeah.
I feel uncomfortable. I'm not okay with the way you treat other people, and like I need space. So in this case, I'd probably be like, hey guys, I'm feeling like kind of weird, like the dynamic shifted or something.
Right.
Like, can you let me know if there's something else, or like maybe it's just, you know, in my head, but I just wanted to put it out there.
Right.
Because otherwise you're just going to be like guessing.
And that's not fair to you too. Like, and it's not fair to them, right? If it's just like, oh no, like the vibe just changed, or no, like we just jived better as we are roommates that became friends.
Yeah.
We
Or
don't
like we're constipated this week. You know,
Yeah, it has nothing
Jenny's
to
on
do
her
with you.
period.
Yeah.
Sarah's constipated.
It's nothing. Yeah, right.
Timmy
so
got
it's-
dumped.
Yeah,
You know.
it's all we've all been there. Yeah, I think like head on. Don't be afraid of the confrontation because it's not always bad. And they're roommates, right? Everyone graduates. You'll be done.
Yeah, and like you're only friends with certain people after. I speak to like 3 people I went to college with,
Yeah,
and 2
it's
of
like-
them were there this weekend.
It's like same with high school. Like some of them are forever friends. Some of them you're gonna be like, who?
I speak to no one I went to high school with.
I have like maybe 3 people I still talk to from high
0.
school.
Big fat
You're-
0.
no.
No, we done with that.
Yeah, it's okay, baby. Ooh, this is long. I'm also having a very difficult day with my dyslexia, so bear with me if I say a word that is not correct. Is it appropriate to set an ultimatum in a relationship? Okay, they give an example of it too.
Okay.
For example, one partner wants to get engaged and married female, but the other seems content with the way things are male. Both eventually want kids. Some background: couple has been together for 3.5 years, lives together, and are the ages 30 and 29. And the woman is a year older, which I think matters when we're thinking about children.
Yes.
Right.
So I was actually in this situation, obviously not like the same ages, but in a situation where I wanted things to move forward and she wanted things to not move forward.
Yeah.
Like, because we lived together, then she moved out and was like, JK, I still want to be together, but I still want to live apart. And then we kind of like stayed together while living apart. We were going to therapy, of course, because you know
Yeah.
that's one of my rules. And, like, it got to the point where, like, she kept putting all these, like, conditions on it. So I was, like, trying to, like, behave, you know? And so eventually I was like, I'm setting a deadline. For me, it wasn't an ultimatum. It was like, these are what my needs are, and I'm setting a boundary that if my needs aren't being met by this date, or if you can't like commit to meeting my needs, I need to walk away for myself.
Right.
But also, you don't want to have someone do something because of you. Like, they have to want to do it
100%.
themselves.
Right.
So I was very like, you know, pragmatic about it. I was like, I set the time, I think like 2 months there, and we were still going to therapy, and we would like check in about like, where are you at with it? Like, this is whatever. We went up to Penn State like a week and a half before the date was that I set the boundary. And on the drive home from Penn State, I was like, you know, do you see yourself in the next week, like, feeling like you're ready to, like, move back in? And she was like, no. And I was like, then we should just end now.
Yeah.
So we did. And then that was the situation where she met my ex at the appointment for the dead cat. Yeah, that's Kristen's favorite story.
I think the dead cat.
Yeah,
I think
they met over a dead cat. It's great. It's still
love.
together. Great.
I think,
congratulations, guys. It's still so cute. Love that.
My thing with ultimatums, right? It's like you said, like, there's a difference between a boundary and an ultimatum. And I think that what a lot of the times an ultimatum can become is just communication of your need and gauge the person, where the person's at with it, right? Because, like, you're right. If you would have said, and we've been together for 3 years, do you think you'll be ready in 4 months to get engaged? And the person's like, I don't know, right? Then it's like, well, we can check back in and see where you're at. But, like, I want this, and this. And if you're not ready, then that's fine. But then I think we might want two different things, right? It'd be like if one person wants a child and the other person doesn't, then, like, that's not going to change about the two of you, right? And so it's different if that person comes to the 4 months and they're like, I feel so pressured, I have to say yes. Because then you don't want the ultimatum, like you said, for them to say yes just because they feel they have to.
Right.
So I think it's more of like...
that builds resentment.
Right. I think we, in relationships with so many people, give ultimatums, but it's not in the sense of like, you do this, or it's like, check in with communication, and I don't think that we realize how often we do it.
Right. So I will say that in general, I've always told people you have to accept someone exactly as they are, where they're at in that moment. So like, you cannot rely on someone to change. The only reason why I set that boundary far in the future is because we were going to therapy, and we sort of had like a stepwise plan of how we were going to reintegrate.
30, 60, 90.
But had it been like, we're just like trolling around with each other, not in therapy, not doing anything. And I was just like, all right, in 3 weeks, you need to tell me if you're moving in or not. Yeah. Like, at that point, no one's working towards something. You need to just be willing to accept someone where they're at. So like, if someone says they don't want kids, like today in this moment, you need to be okay accepting that they're not going to change their mind. They're not going to change their mind. If they do, great, but they're probably not going to.
No. And you got to, and I think too, like, and we're giving examples of things that like a therapist, I would sit down with the couple if they separate and said, okay, let's do a 30, 60, 90-day plan. And if the goal is at 90 days, do we move back in together or not? That's a timeline, right? It's not an ultimatum, but it's like, then maybe we look at dissolving the relationship, or re-looking at 90 days. Are you okay with you guys? Or, you know, the time that ultimatums aren't okay, right, is if someone is trying to, I feel like, manipulate and keep you away. Like, you either stop talking to your sister or you stay with me, right? Granted, the person's giving you their need. They want you to stop talking to your sister, but at no time do we have to accept someone's ultimatum either. Like, if that doesn't feel good to us and we're like, okay, that's super toxic and fucked up, like, leave. You know what I mean? Like, I think that there's times that ultimatums are super toxic because we make them if this, then this, or if this, or, but if it's just a boundary or something that you would, I guess, naturally do at a therapy session, like, I think that's okay.
And I mean, I think I was going to say caller, the person who asked the question also has that like physical piece where you're 31 and you want to have kids, but you also said your partner wants to have kids. So that might be a question of like letting him know how the body works and how the eggies work.
Yeah, because a lot of
over
dudes don't
30,
know.
Those eggies be going down.
Yeah. I think that's okay too, to be like, what steps do we need to take? Because a lot of times it's like, are you ready? Well, when are you going to be ready? Not what can we do to make you feel better about this? Is there trauma you have left over from being a kid? Is there things that you want to check off those? Should we spend a year traveling any chance we get? No gifts for each other for holidays. We're going to be traveling all the time. Because
can we compromise and like see where your fertility status is? Like get the blood work done, do an evaluation, see how many eggs you have, talk about freezing eggs. These are all things that can happen for both people to have their needs met.
Yeah.
But I will say that if you're living together and you've been together for 3.5 years and there's no proposal, even though he knows you want a proposal, there's probably something there.
Definitely would check in with that, because
it's obviously about him and not about you. You just have to figure out what it is about him.
Right. If there's...
Or he needs to, rather.
So that's our opinion on ultimatums.
Yeah. So, do it. Check your eggies.
Here you go. That one looks long, too.
Oh, this is a good one. Okay. It ends with love you guys. So, we love that for us.
So we'll be good.
I'm a therapist needing a therapist, but have had not so great luck. I don't want to be too picky, but I want someone that can treat me as a client/professional, but not like a coworker/friend. Is that too much to ask? LOL, love you guys.
Well, what do you think?
I love you too.
We loves.
What I will say is I have a lot of clients who are therapists or doctors or nurse practitioners. And a lot of them I've met in the course of like professional stuff, right? So like I have a client who saw me speak for GeneSight and scheduled with me. Same with another client who brought their child to me, all down the line. I think the thing for me is if you know someone in a professional context, are you able to separate that enough that you can see them as a client? Now, for me, for meds, it's a little bit easier. So I have been able to see clients that are therapists. Now, the weird part is when my clients become therapists themselves, and then we start sharing clients, because that's happened too. But I mean, I think you keep the boundary, and as long as you feel like heard and listened to and validated, that's really all that matters. So it's like, once you leave that room. Yeah.
I also, and this might be like opposite of what some people feel. So like if you're a therapist and you need a therapist, right? I see a therapist every Tuesday at 9. Yeah. And I always say, whenever I always tell clients that I'm in therapy as well, because I think kind of like makes them not feel so like that I'm like here, and I always say like you're a therapist sees a therapist, like a doctor probably sees a doctor, right? Like when a doctor is most sick, they probably don't want to give themselves an exam to figure out what's going on. They just want, so I always, for me, I can go there and my therapist will get going with saying, like, well, why do you think you do this? Or let's talk about this. Or, what would you say to yourself? And I'm like, I know the answer. It's just implementing it. So I would say as a therapist going to therapy, I kind of have to check my therapy hat at the door and just be okay with being the client. Because obviously if I knew how to do this myself, I probably wouldn't have to go to therapy, right? And it doesn't mean that therapy doesn't work as a therapist. It just means that sometimes we need to hear it from someone else, right? Like, it just means that we need, the world's best singers still have voice teachers.
Right.
Like,
well, what I will say too is it might be about like choosing what modality of therapy feels right for you, because I think I mentioned this before, but my couples therapist does Gottman therapy. So it's very structured, and she follows a workbook and like a set of, beliefs and principles and whatever that she's separately trained in. So like I'm not trained in those things, and it's something that like I learn from. Whereas if I went to a couples therapist, and I have gone to a couples therapist, that's just like, Emery, talk about how you feel. I'm like, I fucking do that all the time. Like I talked to her about how I feel like yesterday. Like it's not fucking working, bro. Right. What are we doing?
And I jokingly say this, but I mean it, like those who can't do teach. I think there's truth to that, right? Like I don't know, I can't figure out my own feelings and how I'm feeling in a moment, but someone can come in and say, I don't know what I'm feeling, this happened. I know exactly what it is. And you just kind of get them to recognize it themselves. But I also go to a therapist who has a different background than I do, right? I wouldn't want to go to a social worker or therapist. I go to a licensed professional counselor because also they're kind of way of going about it, even if you follow the same modality, is completely different sometimes. And so I don't know, I feel like same with you. It's like if I knew how to do this, I would do it. Or I talk about feelings all day, right? Me, it's like I don't need you to, I need to figure out how to identify the emotion. Like I can talk about my emotion once I know what it is. I just don't know how to identify that baby.
Right.
So yeah.
Right. Whereas in my case, it's more like, what do I do with the emotion that I know is there? And I know why it's there, but it's still there.
Right. Especially with like ADHD too, sometimes it's like, I know the emotion's there. How do I properly or most effectively show this emotion and be heard and not have people be like, oh my God, you know what I mean? Like,
right.
I think a lot of that is for me anyways. I'm like, oh.
But yeah, I mean, I think the biggest challenge though is like, we know too much, you know what I mean? Otherwise it just comes down to what everyone else experiences, which is like, you need to find a therapist you click with. But we're just like overanalyzing. We're like, are we better than them? Like, could I therapize myself better than this?
What I do. That's why I say we have to check it at the door, right? Because if you've gone there and it feels good to you, then don't overanalyze and be like, oh, well, I could do this. Or you know what? Because it's like, you're right. You probably would sit there and do it a completely different way. And if it would have worked, you wouldn't be there, right? So maybe just strap yourself in, see where they lead you. Because I kind of was like that. I've heard like, well, I would have known to do this, this, and this. And then I was like, oh, wait, nope, his way of going about it was better, because obviously if I would have done this, this, and this, I would have probably felt better, you know, like, yeah, those, we all need that. We all need the check-ins.
Yeah. We're also accepting new clients.
We are. So, yes, we are, but
whoever you are out there.
I sit there and I'm like, I got such a huge intake of college students.
Really?
I think they're just like home for the summer and they're like, hey, I gotta have a check-in because listen, college is fucking hard. Like,
well, if they need medication.
Yeah.
Here I am.
What are the pros and cons to actually getting an autism diagnosis? I'm late diagnosed ADHD and suspect I have autism because I identify with the female characteristics. Is staying self-diagnosed okay? Sorry, I'm like, have indigestion. Pros and cons, please. Oh my God, I was trying to get through that. I'm so sorry. So they have late in life diagnosis of ADHD. They feel like they could have autism because they see that they have a lot of the female characteristics of it. What do they think that they should go for it, or self-diagnosis, pros and cons?
So I feel like we could answer this as, you could answer this as someone diagnosed with autism. Yeah. I can answer this as someone who diagnoses.
Right.
And then, I don't know, we could probably answer as something else too. But do you want to do yours first, or do you want me to do first?
Oh, no, you go first.
Okay. So as someone who diagnoses, obviously as people have become more aware of how autism presents in adulthood and why it was missed in childhood, and that has become less stigmatized, then more people are coming forward wanting to be evaluated and assessed. Now, I have worked with individuals that are probably like at the lowest functioning level of autism, that have like profound intellectual disabilities. And so like very severe challenging behavior, and need like a lot of support, like from the county, from the state, like we need funding, we need services, etc. So that when someone needs services, needs resources, 100%, the diagnosis is always super important. Other than that, like without needing services and whatever, if someone feels like they don't know who they are, they don't understand why they feel the way they feel, they don't understand why they interact with the world the way they do, they don't understand why they're misunderstood or why everyone like treats them a certain way, or you're just feeling like anxiety, depression, whatever, that's just been like completely unresolved, then I think going for an assessment is valuable.
Yeah.
Now, if you have ADHD, you're diagnosed late in life, you are treated, you're living your best life, like you're functioning fine, you are doing all the things you want to do, you're not being held back by any sort of symptom or whatever. Like, I don't see a ton of value in like going and getting a formal diagnosis. Because
Especially
it's not
it can
going to
take like 10 months in some cases.
and be expensive.
Yeah.
You can certainly say like I identify with a lot of traits of autism.
Yeah.
I mean, that's totally fine. And the thing is, like, as I've said before, you could go to 10 different providers and 7 are going to say you don't have autism and 3 are going to say you do.
Yeah.
Like, there's people all up in your comments saying you don't have autism.
All the time.
Sometimes I go in and I'm like, and then
Yeah.
I'm like, why am I even responding?
I think there's so much that goes into it. And I think especially with autism, we've gone through so many like iterations of it, right? Even since I was diagnosed in the 90s to now. And I think a lot of the issues is there's this like cutesy little, I'm a little bit on, and there's no little, you're autistic or you're not. What it is the scale or the spectrum is how much support is needed, right?
Communication deficits.
Yeah, like where what is needed, right? There's not a severity of autism, right? There's different like contributing factors that go into it. And so I think something that like really shakes me and kind of for me was that like I had lived, when you are getting therapies and you mask and all these things, it doesn't feel good. I don't know how to explain other than that. It doesn't feel great. Like, yeah, there's no way of really describing it. It would be like someone telling you that you have to walk forward and everyone's saying you have to walk backwards the rest of your life. I don't know. It feels strange. But what validated me and not even seeking it, right? Like my therapist was the one who was like, I think we should look into this after an ADHD diagnosis. Some of what you discuss or talk to me about isn't solely kind of check marked off of an ADHD diagnosis. And for me, it was just a validating moment of recognizing that so many things that I found to be very difficult in life, socializing or feeling like I couldn't be present with people or feeling like I wasn't as close to people as I wanted to be or figured out. And I felt sometimes like I was climbing a wall because I'd be like, I don't miss people. But then like, you know, if right now I'm like, oh yeah, my dad exists in the world. But then if my dad called me, I'd have this ache in my heart. It's like, oh my God, I miss him so much, right? But something like that made me feel like I was going crazy, right? But some of these things are just knowing that it's not that anything's wrong with me. It's just knowing that I see and adapt to the world differently was validating. Do I need services now as an adult? I don't. Did I need them as a kid? Absolutely. Absolutely needed those services. And I think it's the same now. If you're constantly, like you said, going through depression and strong anxiety, you might need services then. And I think you said it. Well, I agree with this. I think we aren't nearly as expensive as some places, and usually you can get in about 2 or 3 weeks if you need an observation. Some people wait 10 months, and it's a few thousands of dollars to do it. So if people don't want to allow, again, I'm privileged enough to get formally diagnosed, but if you sit there and you look at the criteria and you tell, like you said, I
self-diagnose.
I self-diagnose, but you said it in such a great way. I see a lot of the symptoms or the traits in myself. Mm-hmm. I think that's great. And if doctors and psychiatrists have a problem with that, make yourself a little bit more available.
Mm-hmm.
Like poor people. Oh my God.
Yeah.
Oh, this is so a you one.
Okay. Are there any supplements that work just as well as prescribed medications to treat mental health symptoms? What a loaded question.
I was going to say. I'm like, does melatonin help you sleep? I don't know.
Well, you know the words I'm going to say.
Yeah.
What am I going to say?
I don't know. I'm scared.
The word I always say, meta-analysis.
I know. Oh my gosh, these meta-analyses.
They were making fun of me all weekend because I kept saying meta-analysis. Okay, so here's the thing. the first thing I want to say is I don't understand why people are more okay with supplements than prescribed medicine. Because what I will tell you is that a lot of, or all medications undergo rigorous testing to make sure that what they're telling you in that capsule or pill is actually in there. Like, it's regulated by the FDA. Supplements are not regulated. There could literally be, in a melatonin capsule, there could be like 75% sand.
This is true.
That's okay.
There's a lot of things about this. Like, this is wild to me.
They've done a study before. They looked at like, I think like 25 brands of melatonin or something, and there were maybe like 3 of them that had like what they were supposed to have.
Because you can look in the back, it might say melatonin, but it might be like the lowest amount for it to be considered a melatonin tablet.
Yeah, or it doesn't matter because it's not regulated, so it doesn't even matter if it's not. And so, you know, you don't know what's in these things. Now, having said that, there are a lot of things that are important that we need that our body doesn't make enough of. So like iron supplements, 100% affect mental health if you need iron. Vitamin D affects mental health if you need vitamin D.
Yeah.
Folic acid. I could go on for 45 minutes on methylate, probably actually for 48 hours on methylation and why methylation is important for mental health. But L-methylfolate, any methylated B complex vitamin, B12, B6, all of those B vitamins are very relevant to mental health. So if you look at the folate cycle, there's a few, like SAMe, you know, SAM-E, there's enough research to support that there's some utility of that. That is part of the folate cycle, which is likely why it's effective. Like L-theanine, that's another one that has a lot of support behind it. There's support behind magnesium. When I worked at an organization as the assistant medical director, I had to write policies, and the individuals we served had autism. So as I'm sure you know, there are lots of things published about autism that are not accurate, i.e. the vaccine study that had forged data.
Wait, girl, did I tell you that I fully had a professor in the graduate program tell us that his wife, who is also a mental health worker, clinical mental health worker, they think that their daughter, they wouldn't let their daughter get vaccinated because one of her clients' parents said that the child got their autism from getting vaccinated. That was a very roundabout way of, I don't know if you guys understood that, but
understand.
A professor's that was like, my wife had a client who's autistic and the parents said it was because of vaccination, so our daughter's not vaccinated.
Without vaccines, the lifespan would still be like 30 years.
It's wild. Like, I'm like, in our old age, we still think this? When so many studies have come out, like...
The original study that made everyone think this had inaccurate data. Like, they fudged the data. So
wild. Jenny McCarthy, come on, babes.
I know. So, and that's not to say that vaccines can't cause encephalopathy. They can. Like, you can have a reaction to a vaccine that causes some damage, but not just autism. Like, not autism. Do you know what I mean? That's not to say that, like,
autism isn't coming from a damaged brain.
Right.
Like,
that there's not medical consequences of
100%.
vaccines. There absolutely can be. Just like there can be medical ramifications of anything that we do.
Correct.
So I was working at the facility for autism, whatever. So like a study would come out, like broccoli extract, for example. Johns Hopkins came out with like one small study on broccoli extract. So then all the parents were calling, like, we want to put our kid on broccoli extract. So when I wrote the policy, I wrote it as there need to be 3 peer-reviewed studies published.
To replicate the same.
Right. That document that there's some mental health effect of this supplement in order for us to consider prescribing it, because in residential care you have to write
Yeah.
orders for even over-the-counter meds, which I think is a good thing to go by in general, because you could, like, some of these people you go to that give you like a list of 32 supplements that you should take, and that's what's going to make you feel better. Like, I can assure you that there's no human on this earth that needs to take supplements 5 times a day.
Oh my gosh.
In excess of like 48 supplements and
That would hurt my
teas and
stomach.
shakes and whatever. Honestly, if you're one of those people who sees someone who has recommended that you take like 10, 12, 15 things, I want you to sit down and write out all the ingredients of each of them. And I promise you, you will find duplicative ingredients always.
It just sounds like... Also, I have to say, you can tell me I'm wrong. Is there a difference, though, between supplements and vitamins? Because I feel like there's probably...
Well, like vitamins and supplements. So like you have the vitamins
Right.
that are like vitamin D, B, whatever.
Yeah.
Like we know, and then supplements are just like endless.
That's what I was thinking too. But yeah, I think there's a lot of stuff that we take, right? And I'm talking like across the board. But like for you to sit there and take 40 some things a day, like that just like even if we're talking about medication, right? Like depending on why you're taking 40 things of prescribed medication, that's just... I feel like I'd get full very quickly.
Right.
Like I eat like a bird as it is right now.
Yeah.
But I'd be like, I had too many pills. Like having 40 M&Ms, that's a lot in your tummy.
Yeah. And I will say too, like, I don't want to set up this dichotomy between supplements or medications,
Right.
because they complement each other.
Sometimes they like help boost the other.
Right,
Yeah.
exactly. And there's the rare person that, you know, supplements are what fixes all of the
Right.
symptoms. But more often than not, it's like we're not capturing something within what we're doing with the
Right.
medicine, so then we're augmenting with supplements.
Oh, yeah.
Or starting supplements first, seeing how far we get, and then
Right.
adding medication. So really, it's what I always come back to, which is like, find a provider who listens to you. If you come in, like, I had a text from one of my patients today sending me an article about some supplement. I forget. It was the person who represented Johnny Depp or something. There was some article about the attorney saying something about a supplement, whatever. I'm going to read the article. I'm going to see what it says, and I'm
Yeah.
going to let her know what I think about it.
Right.
Like, I think you need to find someone who's willing to do that and who's not just going to be like, oh, whatever.
I would never. Yeah.
Yeah.
100%.
Yeah.
I like that. I think when it comes down to it, is find someone that listens to you. Remember, were we on the beach? We were somewhere at the Bachelorette party. I said, "You're joking. I don't think we need to study on this." But what was it? It said like, a study was just done that women are more likely to not have to return to the hospital or not die if they have a female doctor.
Oh, yeah.
Because by and large, not, you know, all the time, but by and large, a female doctor is going to actually listen to the patient, right? Where sometimes I think that there's like what's it called? The God complex that some doctors can get. And it's just like, you're fine. Like, what? Like I've told you before, the doctor that ignored my blood results, it's like, you have the cholesterol of an 8-year-old. You're probably good. Come to find out, it's like, no, it's the lithium, babes. Like,
Or every medical provider that ignored Colleen when she went to the ER for a year with nausea and she had a tumor.
yeah, you know, just maybe believe women when they say they're in pain. I don't know. I think that feels...
I mean, still thank God to that one PA that finally did something about it. She'd probably be dead.
Yeah. And I think that's what... There's so many stories I hear. I was listening to one on NPR about a dad who was a doctor. I gotta say this. The dad's a doctor, and he's a family physician. Okay. You're going to be so pissed off when I tell you this. Like, you're going to be so angry.
Okay,
he's a physician. He said sometimes, which goes into a bunch of the other questions we have, that when he's either sick or his kid's sick, he is really not readily going to tell the doctor, oh, hey, I'm a physician as well, because he doesn't want them to feel intimidated or for them to feel like there's going to be pushback. He's like, I trust other doctors and their specialties. Well, his daughter had a specific... condition that, I don't know if they had surgery on her neck, but her neck didn't bend. And then she was getting like lockjaw. And so the dad had said, you know, she's saying that she's having difficulty breathing. You might want to think about intubating, before it cuts off, like if something were to happen or she was to have an allergic reaction or something. And they didn't say anything. And then the dad said, I'm a doctor. I think that what you should do is if her neck doesn't bend and her mouth's not opening, if she starts to completely not be able to breathe, you won't be able to intubate her. Like a tube won't go, her mouth won't open. The next day, she stopped breathing. And they had to do the surgery where they cut it there. And she like passed away 9 days later because her brain went too far without. This was less than 24 hours that the dad said, you need to do this for her. And she kept saying, I'm having difficulty breathing.
What was she in the hospital for?
I can't remember if they said it was for like, if it was a reaction to something, she was sick.
She was getting short of breath.
But she was like, there was something wrong with her breathing. And because she was getting the locked jaw and because her neck did not bend at all. And he was a doc. I mean,
that's one of those things where like, I would have been like, I am not leaving until the tube is in her throat.
Like, and I get an idea of like, but she's breathing and awake now. Why would we want someone to be uncomfortable? But if it's the difference between sedating them so that they can breathe just so we're out of the clear and then them dying.
I mean, I don't care. The reality is you have a parent that's a physician that knows their kid and knows medicine and is telling you this is what we should do. This. First of all, that doctor is a fucking idiot.
And
because that's a liability. If nothing else, if you have no heart or soul, you didn't listen to a doctor, she died, and now you're liable. Like, why didn't you just do it?
The child was a college student.
Stop it.
So they weren't even listening to a grown adult saying, I swear to God. And Pierre was saying, like, because they were talking about, like, the high rate of... Are the parents
suing the hospital?
They did, yeah. And now the parents are, like, advocates about, like, you know, but, like, my mouth, like, I was like, oh. And, like, the whole hospital actually got investigated for just constantly kind of not listening. But I was like, I can't imagine. Like, I can't imagine. Did the hospital
find that there was malpractice?
I think so. I mean, come on. Like... Not only did the dad say something, the daughter's all saying, like, I'm having difficulty breathing. And they said that she looked like she was in the incline, then went down. I mean, horrific. And I know, like I said, it's the God complex, right? And that doctor obviously was not like, I'm going to let her get sick. Because he probably thought in his heart of heart that she was fine. But, like, oh my God, that scared me so much when the lights fell.
Jesus Christ.
But, like, I'm sure that, like, it wasn't, like, you know, to be a dick or something like that. But, like, still, you didn't listen, and now...
well, I told you that happened with Molly's dad and the brain on fire thing.
Brain on fire? Yeah. I remember he was talking about brain on fire.
Yeah, the doctor had, like, this God complex. He was saying, like, oh, no, he has Alzheimer's. Like, we're discharging him. He has Alzheimer's. I literally flew down to St. Louis and like busted in the hospital. And this dude is still being a dick to my face. Like, I'm like, bro, if he has Alzheimer's, show me the study, like the test. Because you can test for the plaques,
you sure
right?
Can.
And I was like, if anything, fine. Maybe you're right and he does have Alzheimer's. Then you need this test in order for him to get approved for like any of the drugs that there are. But the whole time, like, we were still like pushing behind the scenes for other stuff, because it was an acute presentation of like complete mental status change. Like, you don't have Alzheimer's after like 24 hours. You know what I mean?
Right.
Like, you don't know that you're in St. Louis and then the next day you think you're in Michigan. Like, it doesn't work like that. But this doctor was like, he comes in, he tries to like mansplain the folate cycle to me, which is the last thing you should ever try to mansplain to me, because I could like literally eat the folate cycle for dinner.
Yeah.
Like, and so like I went head to head with him, and like I didn't leave the hospital until what I wanted to get done got done. So, long story short, when he finally ordered the test on the spinal fluid for the Alzheimer's, we asked him to put on an autoimmune panel also, because they're both run out of the Mayo Clinic. And the autoimmune panel is what came back showing that he had the autoimmune encephalopathy, which is swelling of the brain, which is the brain on fire thing. Then, Molly's mom ended up saying to the doctor later, because we found out these test results after they had already discharged him from the hospital saying he had Alzheimer's. Discharged.
Oh my God.
Molly, me, her two sisters, we all had the password to his portal and we were like checking all the time. No one called us. No one called with the results. Molly found the results, told me, I called his primary, and we were all like, you got to go back to the ER because this needs to be treated, right? So they go back to the ER. They actually give him the treatment because now it's in black and white. You can't argue with it. Like, it's an actual disease. And her mom said to the doctor, the asshole one, I was going to say what I called him, but we won't say that. He might be identifiable. She said, if she didn't force you, would you have run that panel? And he said, absolutely not.
Of course. At least he was honest.
Yeah. But her dad would like literally be in a nursing home, like on an Alzheimer's unit right now.
Still brain on fire.
Literally. Yeah. Still brain on fire.
Again, like, especially this NPR thing was like, you know, everyone makes mistakes at work, but when doctors do it, or I guess mental health professionals too, like it can cost someone a life. And it's like, yeah. And so like for me, I could never be a doctor because I would every test, I would give everything under the sun because I wouldn't want to miss something. I'd feel terrible. Right. Way lesser of a degree, but I remember when I had kidney stones, they let me sit around with 4 kidney stones for like, I think it ended up being like 10 weeks. But at one point I went to the hospital because I couldn't pee. I don't know if you guys know what it's like to like be like driving home and like, oh my God, I have to pee so bad. And like you get through the door and your legs are moving, your legs like even itch because you're like, I have to pee so bad. And you're just like, you go and it feels great. For about 48 hours, I had the feeling if I have to pee, but could not pee. Could not go. And so it was giving me anxiety. I was having full anxiety attacks. To give you an idea of, if you don't know this, people who get UTIs can literally have like a full-on psychosis, right?
Oh, yeah. It's the number one cause of change in mental status in older adults.
Yeah. And I was going wild. Like I was sobbing. Jason, like, what is going on? I'm like, something doesn't feel right.
The ammonia starts building up, man.
Dude, and I was drinking so much water because I was trying to pass them. So I go to the hospital and they're like, yep, kidney stone's still there. And I'm like, I can't pee. And they were like, cool, did some tests, I left. That's all they did.
Did they wait till you peed?
They got like one panel back or one test result back, enough for me to leave. But
did urine pass while you were there?
I was able to, I don't think so. I think I was able to dribble something out for them to be able, no, I don't even think I was able to dribble anything out.
Oh my God.
Question mark. But I know they took a lot of blood and they did a what's it called? A ultrasound because they said you've had a lot of MRIs. We don't need to do another one. I leave. I'm miserable. I'm crying all night. I don't know how to explain it. I was able to, this might be too much information to deal with it. I was able to stand in the shower and if for 10 minutes, I was maybe able to get out a tablespoon of pee. Nothing. It was miserable. The next day I check. I have a full-on bladder and kidney infection. And they're like, oh, I said, were you guys going to tell me I had an infection? Oh, you do? It says right here I have an infection. Oh, yeah. So we going to do something? You let me leave the hospital with this infection? And they're like, we'll call something in.
Now that you said that, our client's dad is actually like designing some software, works for some company designing software that catches that.
That'd been great to know.
Yeah, it like catches results that happen after the person leaves, and then implement something for it. But clearly, it's a big enough problem that a company exists to do that.
I called. I was like, they were like, you haven't peed in how long? It's like 24 hours. Like, or I think at this time it's 48. Like, you need to come back. Like, I called the nurse, or the telehealth, and like, you need to go back immediately. And I went back, and they're like, oh yeah, it's right here. And it said I had an infection. I'm like, so you let me leave? So they put it in an IV, and within like, I would say I was there for 6 hours, but within like 3 hours, I was like, I have to pee right now, and was able to go to the bathroom. I probably peed for 10 minutes. It was...
Did the stone pass, though?
The stone passed like... So I had surgery set for a week later, and the stone passed like 6 days. It passed the night before my surgery. That was the big one.
But you were able to get urine past it then?
Yeah. It was... Guys... If I wouldn't have gone back or they wouldn't have said that, I don't know what would have happened because that kidney and bladder infection was terrible.
You can die from too much ammonia.
Oh, like, it was, like, Jason will tell you, my mental health within, like, 24 hours just went, like, I was depressed, sobbing, like, I was just so angry. Like, I felt like I was going, like, nuts. It was...
Yeah, it becomes
Don't get kidney
toxic.
stones. I was toxic, mama. How do you feel about... Sorry, this is the next question. I grabbed it and then been playing with the paper. How do you feel about online app-based therapy? BetterHelp, for example. I use it, and I don't know if my therapist is actually invested in me or just trying to sell me on certain ideas, CBT or just breathing. If any therapist ever tells you to just breathe, leave. Sorry, that's so shitty. I have had in person before, and no, I have tons of trauma to unpack. So if you're talking about, in my opinion, if you're talking about specifically like the online app services, right, like BetterHelp, I don't know about the other ones. BetterHelp is, I've heard that therapists are great with the clients. BetterHelp is terrible to the therapist, though. They underpay them. They treat them like shit. So
they're definitely not taking out an advertisement in this podcast.
Oh, other podcasts I've been on that shall not be named, they had people read it once, and I said, "Ooh, we're not doing that one again, baby." Like, and couldn't do it. Sorry. I don't know about the other ones, so I'm not going to say anything about the other ones, but I know several therapists who've worked for BetterHelp who said they were completely taken advantage of. It wasn't great. And I think if it's accessible to you, if there's another one out there that feels good to you, it's all about jiving with that therapist. If it feels good for them and you, and they're saying, no, I like my job, great. If you're asking about, because you said in person, I see clients, we're not BetterHelp, right? It's Anne Marie's private company she owns. We sometimes meet with people on Zoom. Sometimes that feels better to them, sometimes it doesn't. If you want an in-person therapist, find one. That's great. I think it works. I have people who live 2 miles down the road who see me on Zoom. Sometimes they'll come in person, right? That I feel like it just depends. If you're at home on it and you have family there or friends or whatever, and you feel like you can't disclose, that's different. Come in. But I really feel like it's based on like your need. So if other apps work, great. I don't like BetterHelp.
I mean, I feel like I'm a broken record with this, but like, I don't really care where your therapist comes from. If it's helping you, it's effective, you're connected, whatever, like, keep going. You know what I mean? Like, someone might be paying $600 an hour for therapy that's ineffective, whereas someone else has a copay of $0 with their insurance, and like that person's awesome.
Right.
Like, it's all about how you connect with the therapist, and you know, maybe there's some quality issue in terms of like what a therapist gets paid. You know what I mean? But maybe not. So like, we really can't say. So you just have to like find a good one, unfortunately. And don't be afraid to like move on. I think that's the biggest issue is people don't move on. They're like, oh, this is my therapist.
I tell every client, you're never going to offend me. I don't have an ego when it comes to therapy. If you need someone else, or if we're not jiving anymore, baby, you tell me that, and we'll sit down on Psychology Today and we'll find you someone. But like,
I mean, I will get offended, but it's fine. I'll get offended behind your back.
I feel like medicine's a little different too, right? Especially when you had clients that are like, they do feel better. You know what I mean? Like, therapy's a little different. If someone's coming to me and they're like, yeah, I like your methods, or I don't like this, or like, I want to work on whatever, I don't know. Like OCD, but I don't know, because I do pretty decent with people with OCD now. But whatever, if it's something that I can't, I'm going to be more than happy. I don't want you to be with me just because you think that we're friendly and fun together. I want you to be doing better. And if you're not, I'm more than happy to be like, Anne-Marie will find you someone else, or we'll sit down in Psychology Today this. We have a few more.
Okay, let me see. Oh, I like this one. If you could only have 3 possessions for the rest of your life, what would they be?
Can we say it's possessions and it can't be people?
Yeah, I was just going to say nothing alive.
Okay,
it can't be an animal. That would be so fun.
Are we like living day-to-day life, or are we like on an island, do you think?
Oh. Let's do day-to-day life.
Okay. A phone.
Okay. Because
I still want to be able to talk to people.
So then you have to bring a charger, so you only have one left. I'm just
kidding. Phone kit. We'll say that. So I get all of that. I'm not going to say car because I could just, with the price I pay for insurance and gas and all that, I could just Uber to and from work and then just hitch rides with other people. So phone. I don't want to be the person who's, my medication. Oh my God. My medication.
Oh, I forgot. Is that a possession?
It is for me. I mean, you can get arrested for possession on certain medications, baby.
That's true.
Yeah, phone, medication, and it can't be alive. So, this is something that you've probably noticed with the way I buy things or treat things. I don't treat things shitty, but I'm not a thing person. You know what I mean? Like, I might have stuff, but I'm not, like, attached to objects.
There's not, like, something you use every day that you would miss?
My phone and medicine. There's got to be something else,
What about your
though.
computer?
I hate computers. I hate my computer with a passion. And I'm not wearing it now. Probably my fidget ring. Which I'm not wearing right now because when I wear it, you probably hear me. Too. Yeah, I'm sorry if this grossed you out. I now have to not click my fingers because it's in the mic, but I try not to wear it because then I'll click it while we do that. I would probably have that because as silly as it is, that grounds me so much.
Conquering should honestly take out an ad with us because
I literally was going to talk to you today. I'll text you after this. I want a big stone one.
Well, the birthday fairy might be coming.
Oh, okay. So then don't get a big stone one.
Yeah.
Okay, I was joking. Then I won't do that one.
Tell ruins everything.
You will also find out with me, I loathe the surprises. So poor Jason is like, he always tries to do like a little surprise or cutesy thing. And I'm like, I don't like it.
Jason and I were talking about your birthday presents. And I was like, I don't know why we're doing this because he's not going to care.
I love gifts. I don't ever... I have never in my life given a excited reaction to whatever, anything. But, like, it doesn't mean I don't like it. It's just, like, everything's so internalized that you're not going to see me be, like, over something. And I think that's people want me to, like, cry. I've cried over a couple of gifts, but that's about as much emotion. I'm never going to be, like...
What gifts have you cried over?
Someone got me a... I actually cry over... if it's a sentimental gift, like... I cry because I'm like, oh, someone thought about me. You know what I mean? Someone had a painting done of my mom and my sisters. The last photo we ever all took together. That when I was a mess, and then the stupid book that my friend Alex and my friend James made me. I was going through a really fucking rough time a few years ago, and I was doing a musical, and you do like this gift exchange. And my friend Alex wrote a book in the style of... I was playing the Cat in the Hat in Seussical, and she wrote it in the style of the Cat in the Hat, and he illustrated it. And I thought I was going to throw up. I was crying so hard. And it was fun because I'm like, if anyone cries during this exchange during Seussical, that's embarrassing. And then I was...
What was the story about?
Just a teacher who, like, really cares for others and makes other children and adults and everyone feel welcomed, and about, like, painting the nails and everything like that. And I was just... unfucking well. I was like, oh, that's so sweet. Like,
well, now you've issued me a challenge.
If it's a sentimental, it's not hard. I just sit there and just like throw up, cry. But what are your 3 things, do you think, that can't be alive?
Well, if you say medication, I feel like that's not fair because then I have to say that.
I just know me without it would be terrifying.
Because I need my medication, but I didn't know that counted as a possession.
I mean, I feel like it's not alive.
Do nails count as a possession?
No, because it's like on you. I mean, the rings, I
could still get nails though?
I don't know. I mean, because you have nails.
No, I need my fake nails.
Well, then you'd have to grow them out.
No.
I don't know that because I feel like that is a possession.
All right, well then my nails have to be.
Okay.
I've always said that the number one reason that I could never join the military is nails. I mean, Colleen would be like, you could never survive.
You're going to survive.
But I feel like if someone challenged me like, Amory, you can't be in the military, I'd be like, I'm going to do it, except I need my nails, so I won't.
Do you know what we should do?
What?
We should have Colleen make us do like a little boot camp thing and record
it. We would not survive, Tell. We would not survive.
I think it'd be so funny, and we'll record it and put it out there for people to see.
Oh my God. Like grown ass men have like failed the physical fitness test they make them do. It's a new one.
I want her to have me do it so bad. I'm not
You
going to
want to
pass
do
it.
it?
Have her, that's what we'll do.
She'll really criticize your push-ups.
Oh,
For
I'm good.
sure.
I want to feel like a piece of shit.
All right. Well, I mean, I'm sure Colleen
Okay.
will do it. I mean, if it's a competition, then I'll
You're
do
a
it
challenge
with
now.
you.
Okay, so nails.
Okay.
Medicine.
And I guess my phone.
I can see that. I was waiting
But
for
I
you to.
couldn't buy stuff on the phone, though.
Yeah, you could.
No, you can only have 3 possessions.
But it didn't say you can't buy. Oh, that's true. That's the only thing you get for the rest of your life then.
I could never, like, buy things on my Crystal Lives.
And
How
then
would
what's going to
Jason
happen?
and I connect?
You could still connect on the lives, you just couldn't buy anything.
That would be terrible.
That'd be the worst torture to you.
Yeah, it would.
Oh my gosh. Okay, I have borderline personality disorder and severe depression. I'm scared to be in a relationship because I don't want, hold on, because I don't know if they would like me for real, and I don't want them to see my bad side. Sorry, I had to add a word in there because it wasn't written. I like what you say about borderline personality disorder, right? Because it does show a huge level. There's the good and the bad, right? And it does show a huge level of empathy and want, and it's like how it's used. So I don't want this person, whoever wrote this, to one, feel like you're not worthy because you have a mental health or mental illness, right? Because that is so silly. We are all worthy of relationships and love and all of that. And I think that a lot of it, if you are so worried about someone seeing a bad side of you or manipulating someone, my thought is you probably are overcritical of yourself and are constantly undermining yourself and not validating.
That, or like individuals with BPD a lot of times get feedback from other people that they're too emotional, they're too much, they're dramatic. Like they've probably had people break up with them because they can't deal with them, which is really a result of individuals with BPD choosing people who are going to fulfill that narrative.
Yeah.
Which is a whole other story. But what did you mean when I say with BPD you can either use your powers for evil or for good? Yeah. When I think of BPD, I always think of like Wicked, like pink over here and green over here, because individuals with BPD are usually super empathic. Like you can feel the feelings of other people. You have good intuition. You have a very wide spectrum of emotions, which can be a bad thing. It can be a good thing. And the manipulation with BPD is typically unconscious. Like they're not consciously manipulated.
And I do want thank you for saying that too, because I think all this Hollywood bullshit movies. First off, BPD is not multiple personalities. It's not DID.
No.
But yet you're 100% right. A lot of people with BPD aren't intentionally, like you said, manipulating someone. Mm-hmm. Yeah.
But honestly, and that power can be used for good too, because you can get a job that you really want. Like, you know how to get things. And sometimes that's bad because it ends up being manipulative in that sense. And sometimes it's good because you end up getting a job. I mean, there's some study on like how many female CEOs have BPD.
Yeah.
Yeah. I know at least one.
And I think that's like, I have such a problem with this narrative of like those stupid shirts that are like autism's my superpower, ADHD's my superpower, right? Because like when it comes down to it, some of these things aren't like
I ADHD like a boss.
But that's I feel like that's so different than saying like what a gift, right? You know, but also like I'm cursed. Like there's not it's neither of those things. I think it's like when you are fully understanding of any type of mental health or physical health condition that you might have, you learn how to use it and how to use. I always say grief can be used as a resource eventually, right? And so I think that's like same with BPD. When you understand how to effectively understand your own BPD and that you can.
Well, BPD is not even like an external thing. BPD is like the way that your personality was created.
Right.
meets the criteria for BPD. Like it's just the way that you relate to the world. Like autism is the way that you relate to the world.
Yeah.
BPD is the way you relate. There's actually crossover between BPD and autism.
Yeah.
But I think with BPD, no one wants to talk about it. We need to be talking about it.
Yeah.
Either it's overdiagnosed, underdiagnosed, people don't understand it. And I see it thrown around a lot these days of like, I have BPD, I have BPD, I have BPD. There's definitely different severity levels, but there are people who are super impaired by it and other people who have traits that make certain things difficult.
Yeah.
So it's all like a spectrum, but I'm never afraid to talk to my clients about it. I think it's super important to like not stray away from it because the people who do have it, like there are traits that only other people with BPD have that make no sense. That when you're like, oh, I do that when someone doesn't text me back for 5 minutes, and then you feel like you have this like sequelae of thoughts that other people with BPD also have.
Right.
You know, and I think it makes you, that like communal experience makes you feel less isolated.
100%. I like that you said too, like, you know, people are walking around like, I have BPD, I have BPD. And it's like a misunderstanding of what BPD is. Or it's not so much I hear a lot of, my ex is so borderline. And I'm like,
oh, do people still say that?
They do. Or like, and it makes me cringe. Or like, oh my gosh, they are like, they're this and this. And like, they're so bipolar. I'm like, baby, you don't. First of all, you don't know that, or you're conflating what you believe is a borderline with someone who's a narcissist, and that word's thrown around so much too. I'm like, you can be narcissistic, but to meet a narcissist is terrifying. But I don't know. I agree with you. I think we need to talk about it more. We need to be way more empathetic when we're talking about it too, and have an understanding that there's probably many people you know and
way
love.
More empathetic.
Yeah.
Yeah, and this poor person that said this, I think you just need to understand why you feel the way you feel, react the way you react, make the choices that you make, and then you just talk to your partner about it. Like, I call them BPD fits. So like a lot of times when my clients with BPD start to do better, you can sort of recognize like when you're going into what I call a BPD fit, which is like sort of a regression, and it's like super over emotional, like you lose control, they're dysregulated. And then one of the cardinal signs of a BPD fit versus like a manic episode is, well, they're shorter, but also you can it turns off like this.
Yeah.
So, and then you're like, the world's ending, and then all of a sudden the world's not ending anymore, and you're like moving on to the next thing, and everyone around you's like, whoa, what just happened?
And this is why going to someone who understands it, or pairing mental health with therapy is so fantastic, because if you know you have BPD, you have medication for BPD, therapy is not the be-all end-all. It's not going to be 100% a cure all the time, and either is medication. And when you combine in the both, and you're able to be regulated enough that you're receptive, and you have a partner that says, hey, I know in therapy when you're having a BPD fit, we were told that these you recognize these things calmed you down or grounded you. So why don't we go do an ice hold and like, you know, do walks around the house or whatever it is that calms them, so that you don't have people looking around saying, what tornado just happened?
Or your partner's not like, all these things you're saying and doing in this moment are like who you are, because who you are is not the person that you are during that BPD fit.
Right.
And the most functional people can have BPD fits.
I was gonna say the most functional people who aren't even BPD can also have tantrums or episodes where they say unkind and mean things, and people are like, you know what, that isn't who they are. So it's just like, just because you have a label on you, like, doesn't mean that you're excused from having empathy and to be looked at as a whole human. Right.
And when I say BPD fit too, I think, you know, I think people with BPD can get to a very, very functional state where they understand everything about themselves, but those BPD fits, they're going to happen. They'll get less frequent. They'll get shorter. You'll be able to recognize what's happening during it, not necessarily stop it, but
at least you know that.
You know what I mean?
You can
kind of like catch yourself before you can verbalize like to people around you, like, I'm starting to spiral, or you know, whatever. But I think the number one thing with BPDs, I think people need to like let go of what they've probably been labeled as like dramatic and too much and intense and, you know, overbearing and smothering and whatever. Because that fear of abandonment is real. Like that triggers so much. And it could just be like a text message that didn't get responded to can trigger a full-blown trauma response.
And I also think too, because I've had clients with BPD say this to me, and I've had people without BPD say this to me, but do not ever let someone tell you you are too much of something, because that is... That I know when I've been told that, and I don't have BPD, but people have been like, he's a lot. It hurts so much for someone to say that you at your most excited, authentic self is just too much to handle. Mm-hmm. If someone tells you that, I don't know. I'd really reflect on that.
If someone tells you that, keep doing what you're doing. Yeah. Because you are fabulous and people just can't handle it. I've been told I was too much since out of the womb. And
you're like, well, I'm happy, and this too much is healthy. I'm not too much and like ridiculing people and kicking them to the curb.
Like, too much. Like I will be head to toe in rhinestones with like pink hair and
like call me gaudy, but don't call me too much.
Right.
Like baby, I can see if I'm like.
But I'll be too much. You want me to be too much? I say that to my clients all the time. Like if people are talking about you, like you win.
Yeah.
Like that Gossip Girl quote, "You're nobody until you're talked about." I had that shirt in college. Did I talk about this already?
I don't know.
I had a shirt in college that said, "You're nobody until you're talked about," a Gossip Girl. And like, literally, I still have like the fabric from it. I was going to make a quilt. I should still do that. But like, I think about that all the time. Like,
I think it's just one of those things too, where it's like, I go through the two things. It's like, the Gossip Girl quote, but then I also tell clients like no one thinks about you as much as you think about you, because I think that's also that, like, if someone says something to you and you're like you take it so personally, like I can guarantee you in 2 weeks they're not gonna remember it, a week, a day they're not gonna remember that they said that to you. Or they say it
and move on from it.
You know, and you internalize it so much. I do.
Yeah.
I used to do that all the time. I've gotten so much better about it, 'cause I'm like,
yeah.
You know.
Like, what was that thing? Oh, someone on your comments said something about my filler.
Right.
Like, I mean, Colleen got more hyped about it than I did, but I mean, it stung a little bit in the beginning, and then I was like, whatever, I love Cher. If I just look like I have a shit ton of filler. I was dehydrated, okay? It was a bad angle.
But
I do get filler.
This is something, too, though, that, like, I think helped, and as a weird way as that sounds, is, like, I became so desensitized to the negativity because it was constant. It's constant.
Yeah.
If someone's going to say my forehead's greasy, or they're going to have some comment to say about my hair looks green right now, and I don't know why. But, like, they'll say something. And it gets to the point where it's, like, very, very seldom, because like, it has to get to you. It did. Mm-hmm. But very seldom does it get to me now. I have to be, like, already in a mood and read it and be like that, because most of the time I read it, I'm just like, well, I like it. Or, like, oh, well, you know, yeah, I have filler. Thank you for noticing, because I obviously get it, because I want you to, you know what I mean? Like, I think at the beginning, it really bothered me. So I'd only read the first 10 comments, because all the other ones were, you know, eventually getting, but now I'm just like, oh, you know, I feel good. And like, I'm not going to let that negativity, like, fuck them.
Yeah.
I'm so big on like, well, fuck it. They're unhappy.
What was even the question?
The BPD, about feeling like not enough, and that like, baby, you deserve the world.
Oh yeah, I love treating BPD though. By the way, so if you live in Pennsylvania and you need someone,
I didn't realize how many of my clients were BPD.
That's because I have a lot of clients.
You do, you sure do. I think, yeah, most of the clients that I've gotten or have passed on to you, it's like they're like ADHD or just relationship stuff. But I feel like most of the clients I've gotten are BPD, and I'm like, I'm not gonna lie, those are probably some of my favorite clients, because they wear their heart on their sleeves. I love
treating BPD. I have like my little formula that I've learned over the years, and it's so, because they're so fun.
Well, they're just very seldom are you gonna find someone. I feel like most of my clients with BPD, like, they're there to start the emotional process, and they're not gonna sit there and be like, I don't know, like, I'm a little like. They're there to dive in.
But you have to go to like a skilled person with BPD, because have you read I Hate You, Don't Leave Me?
We learned, we like everything that we, every time we say a book movie, we would read excerpts from it.
Yeah. But there's a chapter in there talking about how there's like a huge problem with transference and countertransference, because with BPD, the person is able to read the emotions of the other person, including the therapist.
Yeah.
So it's very easy to become enmeshed with someone with BPD because they're able to read your emotions as well.
Yeah.
So you have to really like be aware of that when you're treating individuals with BPD, and like watch your self-disclosure and that kind of thing.
Yeah. Especially like, there's a couple of clients that we have that I'm like, okay, like how much I do this with every client to be totally transparent. I'm very careful about using self-disclosure as a tool, but there's some that I'm like, I don't think that, I think it'd be beneficial in the moment,
right?
But I think outside of this might not be, right? And that's with any client, doesn't matter their diagnosis, that if my therapist told me something that was a little much, I'd be like, I'm gonna remember this.
And I also think I'm drawn to people who other people say are like too much, or like other people give up on treating or whatever.
You've given me a lot of those, and I'm shocked by that, because so many people are like, I'm the problem one. No therapist ever wants to work with me. They fire me as a client, and I'm like, and I'm gonna be so honest with you guys. I don't think I'm God's gift to therapy at all. I think I'm just empathetic towards people and can validate them, because I have had so many of these clients then say, or like tell me, I've never told a therapist before, and then they say, I'm like, this is our third session, babes, and you've had some therapists for 6 years. It just, I thank God that I went back to therapy. I went back to school in my 30s, and that I have had shitty therapists that I knew I didn't want to be like.
I had a client say to me today, I asked them how therapy was going, and every time I ask how therapy's going, they say, I don't like therapy. I don't like individual therapy. And I referred them to Tell a few months ago, and I was still getting the same answer every time. Today, I don't dread going.
That makes my heart so happy.
Right?
That makes my heart so happy.
I don't dread going. I was like, winning.
I mean, we had a new client come in, and right away I was like, I feel like I can do a lot. I really think you should just get a formal diagnosis, though, which I would almost never do, because again, we're just treating symptoms. But I'm like, this will really play a part into what avenue. And they started going to, and for the first time in their life, in their middle age, they are regulated, and they were like, I've seen so and so and so. I'm like, this is what happens when you go to people who listen to you, or even, okay, maybe it's a 15-minute med appointment, but you stretch it to 20 or 25 because they need to be heard, right? People, there are good
chit-chatting about something.
Well, and I think that's a huge thing too. It's okay to go into therapy in the first 10 minutes, talk about not something therapeutic, because in those moments I can get so much details out of you.
Yeah. I love catching up on my clients' lives. Like, one of my clients texted me that they needed a refill and they got engaged. I was like,
that's sweet.
Especially the ones who've been through such shitty breakups, and then when
it's a win for everyone.
Yeah, when I talk them through the breakup and my whole spiel about choosing yourself, blah blah blah, and then they get engaged. Love it. Before
we get to the last question, I'll say this too. There was a really good, I think I might have talked about on here, the TikTok that's like, no one, and it's a therapist crying. I was like, this is a lot. But then as she was going, I'm like, this is a lot, and I love it. She was like, no one ever talks to a therapist about what happens when the client can stop coming. Not that they've quit, that they don't need therapy, that they're doing better. And I very, very confident I'm about to lose a client, because we reached their goal, and I won't give a lot of information, but their goal was to work on coming out to their family, and they did. And I sobbed when they told me, because I was so happy for them, and it went really well, and everything is going great. And they generally don't have anything else to work on, right? And if they wanted to come maintenance, or if they get in a relationship or whatever, but they had no inner conflict with themselves. It was family stuff, and my heart was so happy. And then I started crying, and then I thought, they graduated. Like, they're doing, they did it. They did it. Yeah,
that's how I feel when my clients become therapists.
There's got to be no better feeling.
Like Seth, sometimes I go back and like watch those
The
videos I
episode.
made about Seth. If you haven't watched the videos with Seth, go back and look at them. Like it is, like my heart, like I can like physically feel it, like thinking about it, like thinking about how much work he did, and
Yeah.
like, and then you think
You
like,
said Seth's name, and he sings, and I'm hearing music.
I'm hearing music too. Seth, is it you? Is it?
It's in the office. Music's playing in our office right now. It's just the two of us.
What is
I
playing?
don't. Can. Do you have an Alexa? Is that what it is?
Alexa, what song are you playing?
This is It's a Great Day to Be Alive on Down the Road I Go by Travis Tritt.
We have to ask him if he's ever sang a cover of this. That's
It's
weird.
a great day to be alive.
Yeah.
Is what started playing.
That's so funny. Alexa, stop playing the song. Weird. Because he sings. Like, that's a huge thing he does. Like, his entire... That's weird.
It's a great day to be alive. Betty!
I know, my mom, God. If you didn't know, we're convinced my mom, she passed away a few years ago. And
Betty hasn't done shit in here in a while. So that shit was
wild. That's so fucking weird.
Oof.
Okay, this is a good one to end on. It's a lot.
End our season?
End our season. We'll be back in 2 weeks, but end our season.
Oh my God. Wait. Before we go, after we do this one,
Yeah.
we should do like favorite moment of the season.
Oh, for sure.
Oh, okay.
I'm newly out of the closet at 37. Congrats. And met my first girlfriend in
baby lesbian.
I know. In the first one too. In the psych ward, we both have EDs, eating disorders, right? See the same dietitian and therapist. Ooh. How to I think they want to know how to handle, because it just says cry face, like laugh face, how to handle my body insecurities when we are intimate. Combo of dysmorphia and inexperience. Well, the inexperience is normal, right? Like this is new. Babes, here's the first thing though, and I'm not gonna get, this isn't a place of judgment. You can't have the same dietitian and therapist. That's a conflict of interest.
I know that the eating disorder world is small.
Yeah.
I came from it. I've worked in it. I still work in it. It is a horrific idea to share a therapist with your partner, unless you're doing couples therapy.
Well, for sure. Yeah.
I even have like a best friend pair that tried to have the same therapist.
You can't.
It did not. You can't. Dietitian.
Yeah.
I might be okay with dietitian, to be honest.
If it's like
If the dietitian keeps good boundaries, because sometimes they
and if it's like medical, I feel like
dawdle
too,
into
right? Because
therapy.
like my husband and I go, well, we don't go to the same doctor now, but like we'd go to the same, if it's pure clinical medical dietitian stuff. But sometimes I feel like dietitian can be therapy. Yeah.
But I mean, sometimes I consider like, should I? Because when they break up, it's
well, or you don't want them to put you in the middle of it, or can we do a combined? Like if they would ask for a combined session, I'd be like, no, because you guys are so. It's so. I don't know what I can and can't disclose in that case, because I think that it could be a casual thing, and that's great. I would just be very cautious, and not in a bad way, but be very cautious that when you guys are, if you're still in the psych ward, or if you guys have left and graduated from there, just to be very conscious of, as we grow and get healthier and get better, we might be a little bit of a different person than we were when we first met them.
Well, and also I think it's important to remember that you both likely have trauma. You both clearly have, eating disorders, which have a profound impact on your medical and mental health. And you struggle with a lot of the same things, but probably for different reasons.
For sure.
Though you may be at a similar point in your treatment, since you were both in an acute inpatient setting. And that's really going to be difficult. So I would almost consider, if the therapist does couples therapy, to shift into couples therapy and get 2 individual therapists. Because I 1000% believe that you should be in couples therapy with all of that going on, especially as a baby lesbian.
Yeah.
You know, it's really hard to navigate. But another piece of advice would be to watch The L Word. I'm not kidding, watch the full series, The L Word, then you can watch the new L Word after that. It is, honestly, I think it is very helpful for new lesbians to sort of like watch a group of lesbians like exist in life.
Yeah.
It's like Friends for lesbians.
I feel like, honestly, like, get the vibe, get the community, jump in. I don't know. I think you're right, though. I think that, like, see if the therapist would do couples, talk with a therapist quite a bit beforehand and see, like, what they're, if they're comfortable doing that, if there's going to be open communication then, or, like, because it might put them in an awkward spot to be like, well, when you talk to me about your dad, right?
Therapist.
Like, you know, 1, 2, 3, 4 of who gets to keep the individual one, but
it's just messy.
Yeah, like I know I would absolutely 100% could not go to the same therapist as my husband. Like I wouldn't be able to do it. I'd be like, well, what did he say? And I know they can't tell me that, but I would sit there and be like,
it's also very hard. Like I have a couple who broke up a long time ago, but one person is still like really struggling with it in like a really profound way. And it's really hard for me to know the information from the other person and not be able to say anything.
Or just to be like, I don't think, like, is there a chance we could get back together? And you're like, like,
yeah. I mean, luckily they don't.
Yeah.
In the beginning, I was in that position a little bit, but what I did in that scenario was like, I went to my client and was like, I need you to tell me if the person asked me this, this, and this, what do you want me to respond? And, you know, that's how I manage that. But you also have to see someone who like cares about boundaries and figuring out what to do and whatever. My job is very multifaceted.
Truly is. Okay, so like we said, we say season 1 and 2, it's literally a 2-week hiatus just so we can va-boom and you guys can give us, what is it?
Not tips or tricks. Like, what are we going to do? A focus group?
Yeah, so we're going to kind of look through our comments and see who's regularly been commenting. Or
Carmen.
We love us a Carmen.
Carmen's going to be the facilitator of the focus group.
And
I just made that up.
What do you like? What do you want us to work on? You know, we used to do this all the time before. A lot of podcasts, a lot of podcasts do like months off, and I don't think I could do that. I feel like I would get.
I feel like we're a baby. We're like a baby lesbian. I don't think I'm.
A lot of the times they take months off to tour or travel or something. Still with that, but I feel like that's just too long.
We're not gonna do.
No,
that.
It'll be 2 weeks. We'll be back like what I said. Our next recording would be like May 22nd. So it's. If you don't know now, it's May 1st. So it sounds like it's 3 weeks. It's two.
We'll be posting some content.
Oh, for sure. You'll still be getting content, just not full episodes. But okay, so my favorite, I genuinely, this can sound cheesy, the growth we've done, like, not today, but like last week we set up the podcast in like 10 minutes. Mm-hmm. The first time we tried recording at your house, was it?
Yeah.
It took us...
We couldn't do it the first time.
Yeah.
Remember?
Or there's one time we filmed an entire episode and couldn't use it. There's another time it took us 4.5 hours to set up because the audio wasn't working.
And then it was like midnight and we were so tired.
I think we left at like 1 a.m. one night and I was like I was like, you know, no, like for example, we were going to start at 4:30, but then like I ate, you ate, I put on makeup. Then we had to print these, you know.
Then we got in a little fight.
We got in an argument. I don't think a fight. I wouldn't fight with you because I value you and I think conflict is good. And I always tell people, like, if I fight with my husband or my siblings and I know that, like, it's not going anywhere because I love them, like, I can argue with people. Mm-hmm. Yeah. Fighting.
I mean, I just texted Jason and was like, Jason, I got in a fight with Tal.
Oh. No, I mean, like, I don't know. I feel like if I've said this to a couple the other day, if you're not arguing, then you probably just don't want to be...
We don't want to be work husbands.
Well, there's no passion left. Not like you have to argue it for passion, but if something's bothering you and you're not saying it, you're not getting frustrated about it, it means that, and you're just like complicit to it, it means that you don't care if there's change or not, which means if you don't care if there's change or not, then you don't care.
You were a little cranky crank.
Me?
Yeah.
I just think I get so, like,
no,
I think it's anything. Cranky. I don't know if I was cranky. I think I was like, I remember cranky. This conversation like 4 or 5 times. You think I was cranky?
Yeah, I can tell when you're cranky.
I don't know that felt cranky. Again, though, to be fair, like I'd never know what emotion I'm feeling. Genuinely don't. It's a wild experience with me.
I don't know. I feel like you're generally like a pretty tolerant person.
Me?
Like, yeah, like to anything. And today you were just like not having it. And I was just like not having you not having it.
Because I think I was like, I remember this conversation we had. And then
I
was
have
like,
ADHD.
I know. I do too.
I brain dump stuff.
But I was like, because then I sat there, I'm like, now I'm freaking out. And I'm like, no, I have to do this with my husband. I love him. We both have ADHD too. I'm like, Jason, we were on the road. We were passing 30 and we were on 202 and we're there's a Wawa there. And I said this and you said exactly this. And then he'll be like, okay, that does sound like me. And I was like going through, I'm like, okay, and I was like, no, I did say it. And then I was like, I probably should have left it in the text message.
That's
because
why
then we could say, okay,
Jason and I have a support group.
You guys need one for me because you're right. I'm very not. I wouldn't even say tolerant. I mean, tolerance is the word, but you said it before. I'm very difficult to like. There's no sense of urge. I'm no sense of urge. It's hard. It's hard.
Sense of urgency.
It's hard to freak me out. It's hard to get me to be like, gah. I'm just kind of like, we'll get there when we get there. Not a big deal.
If I miss the plane.
No, I'm not joking. Like,
if we don't get the alcohol for the party.
But and the urgency was
send
like
invitations.
Yeah, the urgency wasn't even in that case that like we're not gonna get. I was like, yeah, the party's at 7. I'll go at 4. And then I was like, you were so stressed. I was like, you know what? It doesn't matter to you when you get it, but it does matter to her. So just go get it now.
Because it needed to be refrigerated.
Right. But we couldn't. It ended up being outside, but it was also like December, so it could be outside and get cold. But
it wasn't cold in the liquor store.
It was not.
Yeah.
The stuff we wanted, they didn't do the Prosecco.
Yeah.
They didn't.
So aren't you so glad you went early?
And put it, outside. No, I would say like the growth though. I feel like we did a lot of growing, like, and that feels really good to know that we were able to like learn and get book through shit like.
And we like let go of stuff, aka like editing the podcast.
Yeah, we're both like that. Maybe this isn't us. What was your favorite?
When we stopped leaving the office at 1 a.m.
Oh my God. Felt so good.
Yeah. No, I think my favorite was when we started to get like feedback from people who listened to it saying like, you guys like play really well off each other. We enjoy watching your interaction and whatever, because we just interact all day. Yeah. So like,
it just feels like a camera's on. Like someone said, it feels like I'm watching someone over like 2 friends over FaceTime. Mm-hmm. Like I feel like we're all together. And
do you feel like you got in a fight with us today too?
Do you feel like you didn't tell us anything about what the fight was about?
I know.
I also, this is gonna sound so like silly, but like as kind of like as much as I'd be like, oh my God, stop. But like someone even was like mentioned like the microphones, and we were both like, ah. And then we didn't. We're like, it's better.
I know.
But like I think I like that feedback. I genuinely like. Even if you give us feedback,
my client's wife said the same thing, and I was like, "We already got boom mics."
But like that stuff is super helpful to be like at the moment, we're like, but like if you were like, "Oh, I don't love this," or "Can you try that?" or like, "We really love this, keep doing that." Like, I think like anything else, in a moment you're like, "Oh," but ultimately like we want. This isn't. We're not doing this for us. It's fun to do this, but like obviously like
Carmen, our hype
woman. Carmen. Or what did the new thingy? I don't know. I guess this is the way that the new kid, not new kids, they're the cool kids.
Wrong?
You take the middle finger and the index, and you do this.
My fingers can't do that.
Oh.
What do you do with your thumbs?
I just tuck them. For those of you who are not watching, I'm making a heart in like the new way, not the old way. So you're probably like, what are they talking about? But
my fingers don't do that.
Yeah, this was a super long episode, but it's the finale. It's the finale. We could probably split into 2, but that would require us to like do work in another intro. So
no, and literally, Tel's never going to be able to upload this video. Never. It might be posted in 2 weeks anyway. When we come back. Just
2 time it as you listen. It'll be great. It'll be good. You'll love. But we'll see you in 2 weeks.
2 weeks. Bye.
Bye.